welcome to Coffee with Cade. I'm so excited to introduce Dr. Eric Widra, the CEO of Donor Options, and he's also one of the senior fertility doctors, also known as reproductive endocrinologist. Wow, that's a mouthful, at Shady Grove Fertility. So, Dr. Widra, thank you for being on the call today.
Sure. I'm not the CEO of anything. I'm the medical director for Embryo Options, which helps facilitate embryo donation for people.
Okay. Well, thank you for that clarification, and I'm super excited to have you on today.
Thank you.
So, I know that embryo donation is a scary topic for a lot of people to think about. Can you tell me a little bit about what it means? How would you define embryo donation?
Sure. Many couples, after they go through in vitro fertilization, will have excess embryos, and we keep those frozen and save them for those families so that they can continue to build into the future. In many cases, however, they have more embryos than they want to have children and struggle with the decision about what do we do with these embryos that we have on ice, if you will.
Okay.
Traditionally, the options include simply discarding them, donating them to research, or keeping them indefinitely, but that's kind of not deciding. And so embryo donation is another way of giving people options for disposition of those extra embryos. And there's different ways to do it. They can donate the embryos to their fertility center saying, hi, I'm done with these embryos. Please use them to help other folks build their families. Or they can say, hey, I have someone I know, and do a known donation where those embryos are actually given to another individual or couple or family to help them with their family building.
Okay. All right. So for those of you who are logging on right now, we are talking about embryo donation, and we have Dr. Eric Widra, the medical director for Donor Options, and also a fertility doctor at Shady Grove Fertility, who's sharing a little bit about that. So for those people who may think, well, fertility treatment is very expensive. I may spend upwards of $15,000 on one IVF cycle. Are donor embryos, is that a less expensive route to family building?
It depends, Camille. It is certainly intermediate between doing nothing or very low tech treatment, which may not be an option for couples, and doing more expensive treatments like IVF or IVF with donated eggs. But okay. It is a very different approach, right? Because this is an embryo that was created from someone else's egg and sperm and already exists. And so there has to be a comfort level with that on the people who want to receive those donated embryos. But yes, compared to something like egg donation, it's considerably less expensive to do this.
So how much on average would it cost for a family?
In our program, the kind of the range for doing embryo donation is probably somewhere between $6,000 and $12,000, depending on how many treatments they need to go through and how many embryos we're working with. There's a lot of individual nuance there that's different from egg donation, because with egg donation, we work very hard to make sure we have donors that are optimal for the process. Whereas a donated embryo, we don't select ahead of time. That's the people who are donating those embryos are self-selecting. And so an embryo from a younger family or a younger woman may have a better chance than one from a little bit older. So there's a lot of variability there. But compared to the budget for egg donation, which may be $20,000 to $30,000 or more, yes, it can be much more cost effective.
And so you made a point there. Everything depends on it's very situation specific. So let's say I decided I want to have a donor embryo. Would I potentially be able to say, and I like the profile of these two families, can I have both, can I use both embryos to try and conceive?
Well, in general, when we're doing these types of treatments, we recommend putting back a single embryo because they are very good quality embryos and they have a very high probability of success. So we would take it sequentially. So you would have to choose, which you want to start with. If that didn't work, then yeah, we could go to another group of embryos or an embryo from a different donor. But in general, we help the recipients choose one donor family to start with, and then move on from there.
And you said that these are good quality embryos. So do you only take embryos from families that have successfully conceived and delivered a baby? So would I already know there is a child that has resulted from this cycle?
The answer is generally yes. Most people are donating embryos because they've already had children and are finished. I guess it's possible that someone could maybe get pregnant naturally or something like that and want to donate embryos they have. But we do go through a screening process. So whenever someone says, hey, I want to donate my embryos, there's a team of us on the physician side who review the chart and say, hey, yeah, this looks like somebody whose embryos would have a good chance of success. There are no known genetic issues. There are no known, serious medical problems. I think these would be good embryos to take in donation. Sometimes they're not. Sometimes there is some kind of genetic issue with the family, or they're old enough that we don't think the embryos would have a good chance of success. But yeah, so there's a screening process that we use. But our goal is, sorry.
No, go ahead. What were you saying?
Our goal is, though, to provide as many high quality embryos as we can for recipients.
That's wonderful. So if someone is watching this either now or in the future and says, hey, we've completed our family, we'd like to donate our embryos, can you tell me a little bit about that process? Do they need to be screened? Is there a fee? Do they have to pay you? Do you pay
to donate their embryos? No, there's no fee there. We do go through, we update their medical screening over the telephone. There is paperwork that needs to be filled out, but that can be done remotely. They have to sign the consent forms. We give them access to legal counseling if they want it, but that's optional. So our goal is to make the donation process as simple as possible. And so basically just get in touch with your care coordinators, and they'll connect you to the right people in our program, at least, to donate.
And is this just a Shady Grove donor, or is this open to anyone from any clinic who may say, I'd like to donate my embryos?
So currently there's no national network for donation of embryos that I'm aware of. So each clinic makes its own decision about whether they participate in embryo donation or not, and set their own criteria for which embryos they take and how they evaluate the recipients. It's certainly possible that, through through tools like Embryo Options, which helps to facilitate this, that there will be a network later where embryos will be available throughout the country to recipients.
And so so the family does not have to pay anything, but do they receive any type of compensation? And also, is the donor family allowed, are they provided information on the family that ends up taking the embryos so that they could check in and say, did this result in a birth, or, kind of what is the connection, if any, that's made between the donor and the recipient?
So it's, unless it's a two individuals or families who come together and say, hey, I know this person, I know that person, I want them to have their embryos, which is known donation, it's meant to be anonymous. So the answer to the first question is there's no compensation to the donors, other than they don't pay the storage fees any longer. Yes. And they give up the right to know what happens.
Okay.
So it is meant to be donation, meaning you give it up and we help other people build their families, but you don't get to know what happens.
Okay, can you see me? I think we've went out for just a second.
I can see and hear you again. Yeah, it just froze for a moment.
Okay, so kind of along those lines, I've heard about some other organizations that provide donor embryos, but they require home studies and things of that nature. Is that a requirement for donor options, or for Embryo Options?
So Embryo Options is really a tool that the practices use more than the patients use. So when someone comes to does embryo donation with us, they're just simply working with SGF, with Shady Grove Fertility. No, we believe, and the ASRM, the American Society for Reproductive Medicine, has clearly stated that embryo donation is not adoption, that you do not need to have the same legal and social mechanisms in place, which are very invasive and very costly. So this is considered donation, it's altruistic, and so no, we want to make sure that recipient couples are counseled properly, that they speak to a social worker or mental health professional about what it means, just like we do for donor sperm or donor eggs or surrogacy. But we don't test them or evaluate them in that way for their fitness to do this. We want to make sure they're medically good candidates for it, that this is a technology that'll work for them, but that primarily requires having a normal uterus. So it's not a very high, not a high bar to hit medically.
So they would go through a medical exam, I'm assuming the same type of screening and testing that any family with infertility would go through, or is it?
It's pretty unusual.
Can you hear me?
I can, yes. I think I got your question. It's pretty unusual for someone to come in to see us with a fertility problem and have embryo donation be up, at the top of their list. What happens is most folks come through, they get evaluated for their infertility, and if we find that they have a problem that we can't solve, like a serious egg problem or age-related infertility that's beyond our ability to help without donor eggs, then the idea of embryo adoption is brought up. Most people want to have kids with their partner, and that's what our goal is. But sometimes that's just not possible. And if that's not possible, embryo donation, like egg donation and sperm donation, are options.
And is embryo donation available to anyone that would have a need for embryos? So, you know, maybe if someone is not in a two-partner relationship, you know, is it available to anyone who may have need of the embryo, or do you have certain qualifications for people to be able to participate in the program?
Other than having, you know, being a good candidate to get pregnant with an embryo transfer, and going through the normal workup and the counseling, no, we don't have any requirements in terms of your social situation in order to access any treatments that we have.
Okay, that's excellent. So for kind of going to some of the questions that Kristen has prepared, and thank you, Kristen, for that. For those who are wondering, what is the difference between egg donation and embryo donation? Can you kind of describe that?
Sure. So egg donation is used for women who are either are menopausal, meaning they don't have any more eggs left to work with, or are typically somewhere in their 40s where the quality of the eggs is very poor. And it sometimes strikes them in younger ages where that once we go through a process of treatment, we learn that they have very poor egg quality or very poor egg reserve. And so at that point, the treatment options are egg donation, where the partner sperm are used to fertilize eggs from a young donor. Those embryos then become that couples or that patients, whether it's a heterosexual couple or using a sperm donor, those eggs and the resulting embryos are theirs. And so those embryos are genetically related to the male partner or the sperm donor, but not to the woman. And so those embryos are then transferred to initiate a pregnancy, and it's a very effective treatment for couples who have an egg problem. It's also commonly what's used in same-sex male couples. So they need both an egg donor, obviously, and they need a surrogate to carry the pregnancy, a second person. So they will often use egg donation with their own sperm to help create embryos for them to build their families. In the case of embryo donation, the embryos already exist and they're genetically related to the donor couple, whether that's a traditional couple or a sperm donor couple, or whether it's an egg donor couple. Those embryos exist, and so they'll have no genetic relationship to the recipient. Because they're already created, because they're already in the laboratory, because they're already frozen, the costs associated with going through the process are considerably less than with egg donation.
Okay, so just kind of to summarize, for egg donor, the egg is donated from presumably a younger person or someone who may have a higher number of eggs to a couple, and they would use the sperm of the couple and the donor egg, or men who are either single or in same-sex relationships would use a donor egg, and they would conceive using their own sperm. And the embryo would be completely unrelated to the couple that would, or the person who would take the embryo and then attempt to get pregnant. So there's the genetics, and then there's also the cost. So donor egg is about how much per cycle?
It depends how it's constructed. We have different programs for payment. We have what's called our shared risk program, which provides a refund of money if pregnancy doesn't work. But the minimum to the maximum on egg donation ranges from about $15,000 to $17,000 to as high as $55,000. The average is probably around $30,000 to do egg donation. Now, that's to take it to its conclusion and have a child.
Understood. And then you're talking $6,000 to $12,000 for embryo donation to the conclusion.
Correct.
So that it is considerably less expensive.
Yes, but it's also a very different way of building your family, and it's not going to be right for everyone.
Right. Absolutely. Absolutely. So for those people who may be open to having a child that is not genetically related, but who also want that experience of pregnancy, this seems like it would be a wonderful way to have that experience. Correct.
And our initial experience with it has been great. We've had lots of nice successes and a nice steady stream of families who want to use this. And so, yeah, I think it's been a really nice addition to the care that we offer.
That's wonderful. Okay, so is there any factor that would disqualify someone from being a donor or a recipient?
So on the donor side, if they have medical problems that may have a genetic basis, we would probably exclude those. If we know that they're carriers of a specific genetic disease that puts that embryo at risk for disease, we would probably exclude that. We want to disclose the family and medical history of that couple to potential recipients. So, if there's diseases for which there's not a gene necessarily, but a strong inheritance associated with it, we might exclude based on that. Age would be another exclusion. So once the donor of the embryo is, over 39 or 40, that embryo is less likely to work. And so that's a relative issue depending on what we know about the embryos. So the bar to donate is relatively low, but we want to know what the family's story is so that we can disclose that to potential recipients. As far as being a recipient goes, yeah, the medical qualifications for being a recipient are pretty straightforward. You need to have a normal uterus that responds properly to hormones so that you can, we can initiate and sustain a pregnancy. And while there are certainly many women who have pretty significant issues there, that's still a small minority of the couples we care for.
Okay, all right. That's excellent. That's really good to know. All right, so how can someone become a donor?
So someone becoming a donor is very straightforward. If you're a patient in our practice and you have frozen embryos that you're interested in donating, simply contact your care team, and we'll get you connected to the right people internally to discuss it. It's very straightforward. You really say, "Hey, I'm interested," and the right people will be in touch with you. But these are only patients within our practice. So if you have embryos stored at another fertility center, you would need to work with your fertility center to see if they accept donations.
Okay. All right. That's good to know. So this is really good. So tell me, how did you get interested in in being involved with Embryo Options and with an organization that worked with donor embryos. I know that you deal with all different types of medical treatment for infertility in your regular practice. So why did you decide to connect with this organization about this in particular?
You know, after you do this for a few years, you realize that patients really are conflicted about what to do with their excess embryos. You know, they've had their child or children and they have these embryos and they feel very torn about what they should do. Should they discard them? What options do they have? And it makes people uncomfortable to be stuck in this situation of just, you know, keeping them in storage and paying that fee annually, but knowing that they're probably never going to use, they're not going to use those embryos to build their family. Their family's done. And while research is the thing that lots of patients are interested in, there just aren't that many avenues for donating embryos to research right now. So they're really stuck. And we thought that, you know, giving families another option for what to do with their excess embryos would be beneficial. It's not a revolutionary thing. There's a relatively small number of donors and a relatively small number of recipients, but it does provide a new alternative. And it's been very well received by our community.
Mm-hmm. Yeah, I know that I've had conversations with many people over the years who were concerned, honestly, about the cost of keeping their embryos frozen and not knowing that they were ever going to use those embryos, and just being concerned about what to do. So do you all do is there a program where people can, you know, is there a show? Do you have some type of education, or are there support groups for people who are weighing their options? What would you say to the person that would come to you and say, hey, we've got 5 great quality embryos. We're not sure we want to, or we can afford to keep paying the storage fee, but we're not sure that we're ready to make any decisions. What do you refer them, or how do you refer them?
And once again, this is only specific to our practice.
Certainly.
But what happens in our practice is patients have access to tons of educational material through our website, shadygrovefertility.com, about embryo disposition in general, whether that's donation or discard or donation to research. And some of that content is provided through Embryo Options. And certainly if anyone, you know, who watches this webcast now or in the future is interested in learning more, that's the best place to start. You can do almost anything through our website, including make an appointment to come in and talk about it. So, and patients who have stored material with us have a login to Embryo Options so that they can initiate the process that way if their decision making is far enough along.
I see. And are there any support groups, whether they be online or in person?
Yeah, we offer a wide variety of support groups for individuals struggling with any aspect of the fertility journey, from, you know, what should I start treatment or not, to how do I decide what to do about, you know, my embryos later. We work with a team of clinical social workers who provide everything from individual counseling, couples counseling, group sessions to address any of the emotional and psychological needs of our patients.
That's excellent. That's really outstanding. So thank you for sharing about this. I've really enjoyed learning about this new organization that's presenting, I think, a novel solution to a long-standing problem. I know that I have colleagues who had children when my kids were born that have embryos that are frozen and that are still trying to think about, what do we do with this? The easiest thing, if you can afford to, is nothing, just continue with the status quo. But, you know, with limited resources and limited space, there may come a time where clinics are not able to continue kind of storing all of these embryos indefinitely. So I think this is a great solution and a great way to help people build families. And also a lot less expensive than some of the other alternatives. So kudos to you. Thank you.
Thank you.
Thank you for sharing your time and your talent. And, I hope that you have a wonderful day. So for those who have tuned in and who have joined us for lunch, this is Coffee with Cade, and the topic is embryo donation. We have Dr. Eric Widra, who is the medical director for Embryo Options and also a fertility doctor at Shady Grove Fertility. So as we talk about coffee, we always have a beverage that we're sipping on while we're chatting during this lunch chat and chew. Dr. Widra, what are you drinking right now?
Just my daily dose of caffeine.
Okay, and I'm drinking water, so I don't have my coffee cup, but thank you for joining us for lunch, and I appreciate you. Have a wonderful day. Dr. Widra, if you'll stay on the line for 1 second, Kristen will take us off of the line.
Thank you for including me today.
Oh, thank you so much. Just hold one.